Okay. All right. Let's see, I have 4 o'clock. So I'd like to welcome everyone who's here and everyone who may be watching. As chairperson of the Jefferson County Health Department Board of Trustees, I'm going to call the regular November meeting to order. This meeting's not held on the normal date because of the Thanksgiving holiday. I hope everyone had a safe and healthy Thanksgiving. So I'd like to call the meeting to order. Can I have a roll call, please?
Mr. Gill,
Here.
Dr. Henry, Mr. Prater,
Here.
Mr. Pig,
Here.
Ms. Davis.
Here.
Okay, we have some visitors. Can you tell us your names, please?
Tammy Stidham.
I'm sorry, name.
Tammy Stidham.
Oh, Tammy. Okay, thank you.
Liz Downer.
And
Teresa Bell.
okay, great, thank you. Okay, so we have 4 board members present, so we do have a quorum. Normally start meetings by reading the Health Department mission and vision. Mr. Pig, would you mind doing that?
Sure. Mission, Georgia County Health Department will champion positive health outcomes and behaviors through innovative programs and community engagement. The vision, advancing the health and safety of Jefferson County.
Okay, all board members and a posted copy of the amended was sent out. So can I have a motion to approve the agenda?
Motion to approve.
Second, okay, is there any discussion on that?
Just for the record, what was changed between the first copy and the second that made it amended?
The,
The award HVAC contract for bid process was
Yeah.
added?
Yeah.
Onto the new one.
right,
So you're asking us to discuss it, or we're not gonna vote on it because it's not underlined?
It's not required to be underlined nor to be an action item. That's just something that we do for purposes of making it stand out on the agenda, but it's not required.
So I think what I'm trying to understand is, are we gonna be, when we get to that item, are we going to be discussing an HVAC bid? Because it's a contract that we have.
I think the building committee is bringing their recommendation to the board to, a recommendation to approve the award of that.
Gotcha.
is this for the new building?
For Arnold, repairs and all.
Oh, for Arnold, okay.
Okay. So I guess what's our bid process? Do we or do we not have like a couple, 2, 3 bids before we decide, or do we vote on it, or how's that
It
work?
goes to the building committee, and yes, after a certain dollar amount, they go out for bid. And this reached that dollar amount, and there were, I know I saw comparisons on at least 3 bids, so.
Gotcha.
Anything else? Okay, hearing no other discussion. Have a motion and a second to approve the agenda, which was originally amended. So all in favor, please say aye.
I
Anyone opposed? Okay, that passes 4-0. Next item is approval of minutes and expenditures. First on the list is approval of the October 2022 expenditures. And that amount is $161,172.21.
Make a motion, we approve the October 22 expenditure.
Second.
Okay, so motion and second to approve those. Any discussion on those?
Mr. Chairman.
Yes.
Looking at the Brisbane, Brisbois, the legal, costs that we're incurring, we were only given, $5,017 from, in our packet that Jennifer mailed to us. And, I actually found, some more legal that's in this. I found some more. I don't know why it's not on there for this month, because it was transactions that took place on the 12th. It says, check number 63932 to Christie's firm. Board governance, $3,385. General counseling, $728, $560 for labor and employment. Real estate, $252. Something to do with Shannon, Otto's case. I thought that was already done. $2,500 also on that. Shannon Robinson versus Missouri Department of Health, $3,500. And then in addition to that, $820 on the 26th of this month for general counseling, more real estate matters, another $56. Some more Shannon Otto, JCHD for $952. Shannon Robinson, Missouri Department of Health, $280. Another $2,900 for board governance matters, which would be Kelly talking to the attorney, you talking to the attorney about whatever matters. With a total of $14,509.
I can answer that.
Quite excessive.
Kristen said that was the breakdown that you saw last. You
Uh,
looked at those invoices last.
So in our packet that you emailed us, it says $5,017. And that just shows that reflects the 26th of October
Correct.
for those 1, 2, 3, 4, 5 items. But then in addition to that, there's these other,
If you look at, it says on that breakdown in your packet, it says check date 11/16.
Which is last month's legal report, ma'am. You've already seen it.
11/16, check date of 16.
So what
Okay.
you're approving is October's expenses, and this breakdown is check dated at 11/16 is when we paid for it, and that's the October 2022 legal expenses.
So on 11/16, you only paid $5,017.
Correct.
So you had paid another time during the same month, the remainder of it, to add $8,492. Do you make out separate checks? Because it has separate items here
They're not separate, that's are separate invoices.
and separate invoices. So you make out separate, no, you just have them listed separately because they're separate invoices or separate items. And then that check probably added up to $84.92.
I don't know the exact number of the.
And that was paid when?
On, are you talking about the one on the expenditure list?
On the 12th?
If that's the date, yes.
Okay, so what, I guess my question is, didn't we receive one of these with that on it? Because it's still the same month. We're still in October. This is October and this is October.
Ms.
they're all-
Davis,
Yes,
if you have questions that pertain to the financial matters or the legal matters, I would appreciate if you would direct those questions to either our comptroller, Kristen, or to our legal, Christy. I don't believe that Jetty is prepared today to be able to answer all of your questions, but all of the information has been given to you in your packet, as well as has been given to you for reviewing last meeting, as well as you will be reviewing the upcoming invoices on this after this meeting, is my understanding. So if there are other things that you have questions about, we pay our bills just like we pay everybody's bills. If there's anything further that you need, I would appreciate if you would direct it towards Christy or to Kristen after the meeting.
so in all due respect, I just wanted to clarify on public record that this month, between October the 12th, we spent $8,492, and then again, we spent another 5,000, so it adds up to 14,000 on public record. I'd like for that to be on record, that that's what we paid for legal fees this month.
But that's in-
With all due respect, as far as having things for our legal fees, we really appreciate that you can add that up, Ms. Davis. But again, this is all information that has been provided to the community. So it is nothing that is uncovered or that is not apparent and transparent to the community. So I would appreciate, again, if we can move forward with the agenda. Thank you.
Mr. Chairman?
So these other bills will show up next month, right?
Yes, they will.
They haven't been paid yet.
But they're still for this month. It's for the month of October, is what I was clarifying. There's another item I need you asked for discussion on these. We're gonna approve these, and so you're asking for discussion. So, Mr. Chairman.
Okay.
Okay. I also would like to enter on a public record again that we're paying, Architect Now another 39, let's see. $39,607 for the Aspen Development Program that's in the school. So I just wanted that also entered onto public record. And that's what I need to say.
Thank you very much. Mr. Chairman, I would also like to remind the viewers as well as the board that all Aspen and Architect Now expenses are covered under grants completely. Mill tax and revenue from the community is not utilized for that service. Again, Ms. Davis, you have been presented this information numerous times. Thank you.
You know what I think would be helpful, Kelly, would be that the actual grant money, you know, like when it was given to us and who gave it to us, those paperwork would be nice to be provided to us, board members, so that we can have it in our packet and then we can refer to that. So we have, when people ask us questions from the public, we've got it at hand. So we don't have to go, well, I don't know, I'm not sure where that came from.
Ms. Davis, all I can say is we've discussed that grant at least 3 times.
It's very general to say grant. What I'm asking for is specifics, like which grant,
We
what date,
specifically discussed the Aspen grant at
like
least
the
twice,
date
and
of the
maybe
grant, money.
Ms. Davis, you
where
were
it
given a
was
presentation
not
that
discussed.
listed the date, the specific grant, and the amount.
All
You have
right.
been given this specific information. Thank you.
The director under control is your-
Yeah. Okay, so we have a motion and second to approve the October 2022 expenditures. All in favor, please say aye. Aye. Opposed?
With the reservation of those 2 items, I will say no.
So you're voting down.
Yes.
Okay,
voting no.
so that is approved 3-1. The next item is approval of the October 2022 electronic payments. The actual amount for those was $498,171.75.
Motion to approve.
Second.
Okay, motion second to approve those. We have discussion on those?
No, sir.
No, okay, so hearing none, all in favor of approving those electronic payments, please say aye.
I,
Okay, so no one's opposed. And we have pre-approval of the December 2022 electronic payments. The estimated amount for those is $605,000, $605,237.25.
Make a motion, we approve the pre-approval.
Second.
December electronic payments.
Okay, so I got a motion and second to pre-approve the estimated December electronic payments. Do we have any discussion on that? Okay, hearing none, all in favor, please say aye.
I,
Okay, no one's opposed. Okay, next item is the director's report. Director Bowman?
Thank you. Jennifer, did you have an opportunity to make a copy of the week 47 respiratory report?
Yes, they all have a copy.
Okay. Just wanted to bring to your attention that we are really starting to see flu cases pick up. A report from our epidemiologist, Sarah Wilton, is showing cases per week during week 47 surpassed any weekly total we've had in the previous 2 years. And it is nearing our highest weekly total that we saw during the peak of the 2019-2020 season. According to the CDC, flu activity has started early across the entire country, and hospitalizations due to influenza are also the highest they have been in multiple years. Nationally, flu vaccine coverage is lower for this point in the season as compared to other points in previous 2 flu seasons. Additionally, other non-reportable respiratory viruses are higher than usual right now, such as RSV, rhinoviruses, and enteroviruses. As with all respiratory viruses, it is difficult to predict what will happen in future weeks. So the best thing that we can do is focus on our prevention efforts, which it's not too late to get the flu vaccine if you have had or have been exposed to the flu this year, pardon me. And as well as what we always are talking in our mantra is hand washing, masking, staying home when you're sick, and vaccinating against COVID and flu is the best way to navigate this fall season. When you're looking at the report, the one things I wanted to bring to your attention is if you look at page 2, you will see that there were 392 cases of influenza A reported in week 47. Those numbers have been growing steadily over the last couple of weeks, but where we have been seeing a majority of our cases has been in the age 5 to 14 age range, with 41% of our cases. So a lot of these cases are in our youth. And again, we're seeing a lot between the ages of 5 and 49. So that will be impacting work sites as parents are either having to take off to take care of sick kiddos or are home themselves with illness. Just again, reminding everybody to stay safe out there, keep an eye on the numbers, and just as we go into the holiday season to try to be as healthy and safe as possible. That's all. Excuse me.
Okay.
I can't help but want to make a comment there, Mr. Chairman.
Yes, ma'am.
I've been continuing to study this, and out of those that have been triple vaccinated, however many vaccinations they can get, they're still ending up sick and in the hospital. The efficacy of that vaccine is not 95% as they first predicted. So how about your comment on that, Kelly?
Well, I appreciate your expert opinions on the matter. As far as anybody who has been following this understands that vaccines are not 100% effective. The thing they are most effective at is preventing severe illness. And so, and the individuals that we are seeing this year and the higher rates of hospitalizations we're seeing more significant illness, but we are also seeing lower immunization numbers. So it is extremely important for people to get the vaccine because it does help to prevent with the more severe illness as well as hospitalizations for those who do get it. Thank you for the opportunity to explain that, ma'am.
Thank you for your opinion.
Okay. We show no old business on the agenda. And
You have a letter to read or something?
yes, I do. I was just going to mention that. I'm sorry, I should have brought that up on the agenda. I got an email yesterday from Ms. Downer, who's here today. And as our practice has been, I'm going to read it for everyone to hear. And please bear with me, it's a little bit long, but I will read through it. So
You can have her read it.
this came in yesterday.
After speak.
Dear Mr. Deal, please accept this email for my comments at the JCHD board meeting on Thursday, November 11th. And list the first item as the Aspen program. I understand the program is a pilot program in Jefferson County and is funded by a grant. Can you tell us who is funding and how much is received in the grant? Which schools are participating and what age ranges are targeted or targeting? The next item is listed as Aspen parent waiver. Waiver states that the child's records will be kept confidential if enrolled in this free pilot program. It also states that the records will only be accessed by or disclosed when necessary to provide services or comply with the law. This specifies the child's education records and/or health information that is collected for the Aspen pilot program. Would you please address who the following authorized persons are and how the child's private information will be kept confidential? Authorized officials, ? What title, ? Counselors at the school, ? Social worker, ? Staff, ? Who exactly, ? Parents, whose parents? My child's parents, ? Guardians, ? Certain personnel at the Jefferson County Health Department. Who exactly? ? Law enforcement officials, ? Regulators, ? Of what? ? Other agencies, ? What other agencies? ? Who from the other agencies? ? Third parties only if required to comply with any legal or regulatory obligations? ? Who is this? How many third parties? ? Crisis counselors? ? From where? ? Professionals? ? From where? ? This is a very vague word. Parents revoke this consent form with written consent to Aspen. What happens to all the data that was already collected in the program? Where does it go? ? Does it get destroyed? ? And by whom? ? How do I verify that this is actually destroyed? ? How long is the data collection stored? ? When the child is an adult, can they request all data returned to them? ? Can this data be used against them as an adult when they apply for a job? ? Is this part of a large stored database where they will be traced for the rest of their lives? ? Does parent have immediate access to the child's questionnaire? ? On another topic, I'm curious about a nonprofit in Jefferson City. Are you, Mr. Deal, attending meetings for a nonprofit in Jefferson City? Are you, Ms. Vollmer, attending meetings for a nonprofit in Jefferson City? If often, ? What day of the week? ? Is it Fridays? ? Who pays for the travel expenses of the, sorry. Who pays for the travel expenses of the Jefferson County Health Department to Jefferson City? ? Or is there a nonprofit budget? Thank you for your time. Elizabeth Downer, from High Ridge. Okay.
You're gonna attempt at any point to answer any of the questions or have the director
Yes.
address them, Mr. Deal?
I got this yesterday, Ms. Davis.
A lot of what she
As-
has to say is what people are asking over and over to people like me when they come in contact with me. I'll see them. You know, they'll mention things like that, those things right there. So
You get a
there's a
lot of
lot of
strange
people thinking
questions.
about it. Out of that.
Ms. Davis, you know, we had two very specific presentations about the Aspen.
Yeah, which none of that was
Program.
addressed, by the way. Those,
I
these are
totally
specific
totally
questions.
disagree with that. You asked questions. A lot of data was presented. I know Ms. Downer is an interested and concerned person. Have you seen those?
Do you know the dates of those presentations?
The
So
la-
people can look
I
them
think it
up?
was the last two meetings.
Was it
No, there
September?
was one like in April was one of them. And then Jen came back, I think 2 months ago again, they gave another one, an update, and then the first of the presentations was pretty lengthy. Both of them had PowerPoint presentations with them and we treat those questions like we would any other request that comes into the board for information, we treat them as sunshine requests.
Well, I know we discussed it heavily about the security of it because we were discussing the same thing with when we were doing the, what's it called, making sure people are not taking drugs when they're not supposed to. What's that again, Kelly? What's the name of that program?
PDMP.
Thank you. And that was when we instituted the drug program for tracking people. And that was a big concern about their safety and security and all that. And that was one of my concerns, to make sure that any of the information was protected. Has to be. I mean, that is a federal law. People go to jail for not protecting people's health information. You will go to jail. I've seen it happen. Okay. So that's one of the things that we have to be very concerned about. And I know that was brought up during those meetings. So, I mean, obviously, we can answer those questions, but I don't think we can get them to you today.
Specifically,
Because
you're
that's
referencing,
all. That's
specifically you're referencing HIPAA when you talk about federal regulations,
right.
correct?
HIPAA.
Yeah, thank you.
There is just a lot of people that have access to that records. The whole list that he read, there's about 9 different titles
Mhm.
and different individuals have access.
Right,
So
well, but if it works like healthcare, you can't have access without it being authorized. If you get in, just quick purview, if you come into the hospital and you're not my patient, I don't have anything to see with you or do with you, but I bring up your file, I'm fired. Immediately, it's an immediate termination. You can't bring up somebody's file without you having necessity access to it. So there is those provisions in there, and I would presume they're the same provisions, Kelly, in this type of program, because it's all health related, correct?
Mr.
Correct.
Deal-
I was like, if you don't mind, I can answer a little more clearly.
Well,
So with
the
the individuals that are listed,
the presentations that we've done already can answer the majority of those questions. The meeting, there was the meeting in April and there was one in September. So what I would suggest that we
Okay.
do is provide copies of the PowerPoint with and links to those meetings where those presentations are made. Which should answer the majority of those questions. And a lot of those questions actually are better directed to the school districts that are participating in the program. They're not necessarily for us because there is school board discretionary choices within the program.
do we know what schools are participating actively?
You can submit a special request to ask that information. We don't have a public forum section of our agenda, but thank you.
Can I say that we have started putting our section,
We can do anything we want for Steve.
Ms. Davis, she's trying to answer a question,
Wait,
please.
people can talk.
Yeah, it's not true, but thank you.
It is true.
No, it's not.
Yeah,
I understand.
it's not
I
illegal.
understand your
You're here
misunderstanding.
to advise us on legalities.
And
It's
I
not
just did.
illegal for the
And I
people to
just
come in and
did.
talk to us and us to
Ms.
talk to them.
Davis,
Just so,
I
please.
just did
clarify
advise you
that.
to legality.
go ahead, Jennifer. I did not mean to interrupt you. I'm sorry.
what I was trying to say was, the section reports that are in your packets are on the website. That anyone can go online and look at those, and there is an Aspen report there as well.
Did it
The same one
answer
that's in
your
packet,
question?
So you can see that report as well.
From the health department.
Also where our approved board minutes are.
I remember, I personally
Right.
remember going through all that and I didn't see any answers to any of the questions that she brought up.
Well,
there,
I think you missed a lot of information then, Ms. Davis.
though.
Ma'am, all I can
Recap
say
of
is,
it.
I think those two presentations will answer your questions, and especially the report that Jennifer mentioned
And I
It-
think Kelly
it-
was getting ready to
it-
say something too, Dennis.
it lists, you know, the people participating and everything else that you were asking about. So, I think as far as Aspen, that's my response at this point. Your other questions, it's very difficult to answer a question that's so vague. You're asking about a nonprofit in Jefferson City? Who is that?
I don't have the name of it, actually.
So what's your
It was
question?
a question from someone else, actually. I put it in the email. I don't have any details. It was a question.
If you can't ask me a specific question, I can't answer it.
I'll get you a specific question.
Thank you. Did you have anything, Director Bowler?
No, sir. I'll defer to your answer. Thank you.
I think just to reiterate on just one more time, I can see her point where there's so many entities involved in this that they would be able to have access to what's in there if something happens, say somebody is almost committing suicide and they have to go to the hospital, you know, there's going to be a lot of people involved in that at that point that's going to have access to those records.
Mr. Chairman, can I make
Okay.
clarification since one, I'm prefacing this with, I do not appreciate that board meetings and opportunities for statements are being utilized to spread misinformation about this program. The second piece is to address that question specifically. Anybody and everybody who might have the potential of touching that system had to be listed in a document in order to be able to give authority. Everybody has different access. As Mr. Pig said, according to federal law, you are only allowed access to what is absolutely necessary for you to work within the system. So a counselor is only able to see the child in their school that they are counseling. They are not able to see anybody else. They are not able to see, they are given the level of access that they are fit for in terms of the amount or the type of work that they're doing. So if they are a counselor, that's the type of counseling. An individual within our agency may be just looking at aggregate reports, which have no private information in it. It is collected information in terms of potentially how many people are using the system. So again, I would appreciate the fact that we have the opportunity to be able to spread the correct information. And I agree with Mr. Deal that the two very detailed information sessions that were provided by Ms. Brown will be able to answer the majority of the rest of your questions.
Okay, so moving on to the other item in new business, the award of an HVAC contract per bid process. So does someone from the building committee want to speak to that?
I would go ahead and ask Steve to give a quick presentation over what you did, the numbers and.
I'm gonna keep passing the buck. That's why I have Steve Crawford here. He did a lot of the legwork on this with the RFP that we put out and reviewing the bids and put the summary together. I was involved with it, but he did a lot of the work. Steve, you got the paperwork there.
So we have the new Arnold building, the original equipment to that building. The building was built in 2004 and 5, I believe. It's past its serviceable life, and as I understand it, we have grant funding from ARPA that is going to help pay for this. We did an RFP for sealed bids. I think that was in September, October, and we got sealed bids from 3 companies with 5 bids total. And essentially, I would recommend the lowest and best bid being DECA Service out of Bend. They will replace it's 4 twinned HVAC systems.
When did we open the bids?
That
Was what, a week ago?
we opened the bids
I can't remember.
at the last board meeting, before the last. board
Okay,
meeting was-
okay.
And then you guys asked me to go back and get data, And so I did a spreadsheet.
So they were all sealed, we all, there was 5 of us in there.
Right,
Okay.
and I did a comparison of the equipment and provided it back to you all and you reviewed it and I think
Right.
you all agree with what my assessment was.
I did, the spreadsheet was very detailed.
It's
Thank you
probably-
again for that.
Thank you.
So was that in a committee meeting of some sort?
Yes,
Okay,
I sit on the building committee.
uh-huh.
It was just a bid opening.
And there were two of you there, two of our trustees there, no more than that?
More than two is a quorum.
Right.
So you're bringing a recommendation to the full board for their approval, right? Okay,
We're on there, but they had superior equipment and the lower bid.
I'm sorry.
They had the lower bid and the superior equipment.
Okay,
68,000 and
$68,880.
and the next bid up.
The next bid I would have thought would be equivalent, would have been local heating and cooling, which is $75,396, which is essentially the same equipment. It was
Pretty easy though.
literally the same equipment lined up side by side. So according to advertised capabilities. So that's why I would recommend DECA. DECA is literally the cheapest and best bid.
okay, and DECA is, I'm sorry,
DECA service,
In fact,
they're out of Fenton.
okay,
As is local heating. as well.
I'll make a motion, we go with the DECA contract or the bid, accept their bid for taking care of the HVAC system.
I second that.
Arnold.
okay. Do we have, well, we have a motion in a second, I'm sorry, okay. Discussion, so do we have any dates for installation?
They can't give us that until we
Oh,
provide the signed documents. I do know, a couple of these companies have contacted me inquiring about where we're at with the process because the equipment, there's supply chain issues potentially with it.
6 months out.
It could be 6 months out, it could
A
be
year.
next month, so
We're gonna have the
once
same
we
thing
sign
anyway.
the equipment and, or sign the bids and we,
If we don't get mine, we're not gonna get it.
right.
so is the current equipment working at all?
It's working. I had to call for service today on a furnace for the waiting room. Actually,
It's on all the time.
it's frequently. And we've actually had to have a service provider rebuild the controllers from scratch on at least one occasion.
This is, they are the original system.
They're original
So
to the building.
what year was Arnold built?
2004.
It's open in 5, I think, so
Yeah.
They start dying off.
They are,
it's almost 20 years old.
Yeah,
I'm told that new equipment nowadays, you won't get more than 10 years out of, so.
no doubt.
And they'll be more efficient systems
Mhm.
than what we have.
And the bids include dismantling and taking away the old
They're gonna
equipment,
recycle. the
installing the new
They're
equipment.
gonna pull the refrigerant out. Probably will clean the line sets and reuse them because they can reuse them. And the old equipment will be recycled and then the new equipment will be put in place.
And anything they mess up with the walls or roofs, they fix.
Yes, we have actually one set of the twin systems is. For whatever reason, they were built into the ceiling. They'll have to dismantle the ceiling and replace the ceiling.
Yeah, I saw that note on the bottom. I really like that was in their bid, so.
That's for the conference room, right?
That's for our conference room.
That one they set up differently.
Yeah, I don't know why they built it that way. It's long before I came along, but.
You were a baby. So any other questions?
Mr. Chairman,
Yes,
when did we have this bid process for architect one for the Aspen program?
That's off topic. We're talking about the bid
I know,
process on the
but-
building right
Can we
now.
get,
Just, that's been asked to me as well.
okay, well, let's go ahead and vote on this. So we have a motion second and a discussion. Any other questions about the HVAC contract? If no, all in favor of approving that, please say aye.
I,
Aye.
So none opposed. Okay, Kelly, do you have that off the top of your head?
I do
Well-
not.
Okay,
I'd have to get back with Jackie on that.
do you know?
I do not.
Okay,
Not off the top
I
of my head.
will get that answered for you. But again,
Should
Ms. Davis, we've had numerous presentations on that. We've had a chance to ask
That question hasn't been answered.
But you,
When
when
the-
here, when we went over it, you voted for it.
Yeah, we had to approve the process.
The vote was taken,
Same, just like.
vote was taken.
Okay.
But there's questions that are popping up now, which are good questions.
Okay. All right, those are all the items. I don't believe we have a closed session today. Okay, so
Make a motion, we adjourn.
Second.
discussion.
Did we vote on, oh yeah, we voted on that. All in favor?
All in favor of adjourning, you say aye.
Aye.
Aye.